Hi, I'm Ed Merrens, the Chief Clinical Officer for Dartmouth-Hitchcock Health. I've been coming to speak to you for the past year and a half about our organization's approach to COVID-19, the ongoing dedication to our patients, and the safety of our employees. I'm back now to speak about the Delta variant, and it is a very different situation than it was a year and a half ago. At that time, we faced shortages of protective equipment, and now we have plenty of masks, gowns, gloves, and expertly trained teams and environments of care to provide for COVID-19 patients. The challenge we face now is with staffing. Across the country, hospitals are struggling with enough nurses and skilled healthcare workers to be able to keep clinics open, ORs functioning, and inpatient beds staffed. A year ago, we had to reduce elective admissions because of protective equipment. Right now, we're having to close ORs and beds because of staffing shortages. We know and completely understand how frustrating this is for you and, honestly, for our staff. This is a challenge like we've never faced. We're working to identify new and novel ways to recruit new staff, to onboard them, and also to retain our talented people that currently work here now. The effort has involved addressing issues around housing, compensation, and other measures. This work is starting to move the needle, but like other health systems across the country, we have a long road ahead. The remarkable thing about the time right now is that we have unbelievable vaccines that have been available that are both effective for preventing infection, severe illness, and most importantly, hospitalization. You're also aware that we have made the decision, along with other healthcare organizations across the United States, the U.S. military, to make COVID-19 vaccination mandatory. We do this to protect our patients and each other. While a small number of patients in our region may not be eligible for vaccination, the vast majority of residents older than the age of 12 are eligible. We stand firmly by the science of vaccination and continue to provide opportunities for vaccination and education and counseling for people that are struggling with this. While the decision that many people have made not to get vaccinated may be complex, they are not based on science. The evidence that we have is that the vaccines that are available are highly effective and very safe. I want to be clear that the care that we will provide for patients who have COVID in our hospital will be based on science, evidence, and approved therapies. The care will not be based on the preferences of patients and families for unapproved therapies or medications. This is consistent with our practice across all our care paradigms. We completely understand everyone's frustration when it's hard to get an appointment, when you're waiting on hold on the COVID-19 hotline, or when someone calls you to postpone anticipated surgery. Please understand the most important thing you can do right now is to ensure that you're vaccinated against COVID-19. During these unprecedented times, we will continue to come to work every day to provide safe care to all of our patients in all of our facilities. Please be patient with our teams on the phone, in the clinic, and in the intensive care unit. Everyone is trying to do their best as we continue to navigate the pandemic, care for COVID patients, and provide all of your healthcare needs. Thank you.